Good evening, madam.
Hello, good evening.
You're muted, I think, madam.
No, can you not hear me?
Hello, good evening, madam.
Hi, Rupali, can you hear me?
Yes, we can hear you.
Yes, I may have little problem connecting my laptop. I'm not at Indore, I'm at Bangalore. So
Oh,
in a hotel, I'm just trying to get the Wi-Fi, but it's okay. They are coming, they'll do it. Otherwise, has our guest of honor and all being connected? Dr. Konar, has somebody spoken to him?
अभी तो कितने हैं?
Maybe I'll let me try dropping him a message, okay?
हाँ, madam.
I'll
अभी तो I am only नहीं. No one has joined like that. Shall I call anyone? Can't hear you, ma'am.
I'll call Dr. Konar
Okay.
and I'll try calling Dr. Rishikesh
Hmm.
and you can check with Vani and Amay.
Okay.
Okay?
Do that.
Right?
Yeah. Yeah. Sure. Dr. Mridula, can you call anyone? Do you have the numbers?
Yeah,
Mridula
just I
ma'am,
will check.
your mic is off.
Yeah.
Yeah.
Yeah. Okay. I will just check just 1 second. I think he's in the group. Madam is in the group. No, I will call
Yes, ma'am,
Vani
you are
madam. Rida
unmuted,
madam.
ma'am. We can hear you.
Dr. Rupali, you got frozen. Okay.
I'll call Amay, sir.
Yes. Okay.
Hello, good evening, everyone.
Good evening, madam. How are you?
All good, good.
Yes, madam.
Hello.
Good
Nam-
evening, everybody.
Kunal sir, namaste.
Namaste.
Good
Am I audible, na?
Yes, sir.
Good, good.
Hello. Hi, Rupali. Dr. Vani here.
Hello, ma'am. Good
Hi.
evening. How are you?
Good,
ma'am.
good. Hello.
Hello, Vani ma'am. Good evening.
Good evening. Good evening.
Good evening.
Good evening, sir. Good to waiting to hear you.
Thank you so much.
Just setting up some things. I'll join in 2 minutes properly.
Yes, yes, ma'am. Sure. We're waiting.
Hi, Brad. Hello.
Hi, ma'am. Good evening.
Good evening. Good evening. I could connect now.
Hello, ma'am.
Hi.
Hello, good evening, ma'am.
Good evening, Brad. Still in office?
Ma'am, I just finished one seizure.
Okay. All right.
It was pre-eclampsia, so I took her.
Mhm. So shall we start countdown and start? I don't know, is Dr. Konar coming?
Yes, sir has joined.
Yes, ma'am, sir is here only.
Okay. I think Rishikesh is in Frankfurt. I
Yes.
did try calling him.
We can start now, madam. So
Yeah, please. Let's start.
Sudeep sir.
Yeah, I just started.
Hello, everyone.
Hello, ma'am.
Hi, Amay.
Good evening, madam.
Good evening, Amay. Yeah, Rupali, you.
Good evening, sir. So
Good evening.
Good evening, Dr. Konar.
Good evening.
at the outset, I thank
Yeah.
everyone, each one of you that you've all come together today. And we are starting our AICC RCOG West Zone Focus Series, which is a brainchild of none other than our Dr. Archana Baser ma'am. And we are looking forward for every month, these series would be coming with different topics, which we are going to cover from OBGY, all aspects. So we're truly honored today to have Sir Dr. Hiralal Konar sir, and we're waiting for Dr. Rishikesh Pai sir also to join in. And Archana Baser ma'am is going to have a talk today. So ma'am.
Hi, good evening, everyone. I'm really happy to see you all on this platform. This is really our effort to talk about the environment and pollution and its impact on fertility. And today we have been really honored to have Dr. Hiralal Konar, who is a person who has worked on this subject. And if you all have gone through the Jogi, his editorial, I mean, his article is there in the Jogi. And when I was going through the Jogi, I called him up and I said, sir, your article is really, really good article. And this, we are thankful to Dr. Purnima Satoskar for giving us this opportunity to run focus series, especially on infertility.
You're not audible.
Not audible.
I'm late.
Madam is
Connectivity.
actually, she has joined from Bengaluru, and she said she did mention that she's having some Wi-Fi issues. So she will be coming back.
Guys, so a role of environment and pollution on infertility. So we have interesting panel lined up, and which is going to be moderated by Dr. Padma Rekha Zirge and Dr. Brijbala Tiwari, and we have all the panelists from all over the Maharashtra, and they are all being handpicked by Rupali and Mridula, And I'm sure I'm looking forward to a really great panel. And I'm really thankful to Dr. Reena Vani for accepting to be chair and Dr. Amay Purandre to be here on this platform with us. So over to you, Rupali, without much ado to start with the CV of Dr.
Reena Vani.
Jalal Kunar for his words of wisdom. I think Rishikesh couldn't join because he's in a different time zone. He has conveyed his best wishes to us. So let me introduce our chief guest for today, Professor Dr. Hiralal Konar. He is member of Oncology Committee AOFOG, Foxy representative AOFOG in past, chairperson Indian College of Obstetrician and Gynecologist, and national corresponding editor of Journal of OBGYN India. President Bengal Obsgynae Society, VP Foxy 2008, and recipient of Pride of Foxy Award 2019. And he's a great friend, and I've known him since long because of his. I think I organized a conference way back in 2005 in Indore.
Indore.
That time,
Right.
Professor Hiralal Konar was there with us, and since then we are connected. So, Professor Konar, for you to say a few words about the impact of environment and pollution on infertility, fertility, and our lives in general, and give us some advices on this topic, plus how we can really improve.
Thanks, Dr. Archana. I am really so happy that this topic has been considered by the Western RCOG. Probably it is going to be accepted by Foxy and all of us, all the societies. This is the need of the day. This awareness is the need of the day, basically. And if you look into this situation, that global scenario, and our country perspective itself, we need to know much detail from our own country. To tell you a little bit about this information that we have got, if we look into the natural calamities like your tsunamis, earthquakes, or the all the accidents, it hasn't got much that of effect on the global effect on the health. But once it comes to the man created this devastation, or that of the environmental pollution, or creating disbalancing that of the environment situation created by man, that's a real problem. And if you see that urbanization, deforestation, industrialization, that's the main area. And we all know that of the 1984, the Bhopal gas tragedy, this is the dangerous one, gas leak of insecticide, pesticides from one gas plant, several thousands died. And the legacy is still continued with that of the genetic aspect of this problem of the pesticide. Now, look into the overall subject that that our interest is there. Three ways we are looking for. One is that of the total environmental pollution, like that of the atmospheric pollutions, particulate matters, nitrogen dioxide, ozone, and all this leads to that of this protein desaturation, lipid desaturation, all this. And then thereafter comes that of the other one, that's the exposure to that of the pollutants, that is agricultural pesticides, and that of the insecticides, all these. What happens, these has got that of the significant change. These are called the endocrine braking system. Neuroendocrine braking system is that of the all these pollutants. That means the endocrine system itself is being defective with this environmental pollution. There is a chronological events over the years. Now, last part of this is that of the persistent organic pollutants. Those are the unbreakable. They cannot be degraded. So that those are the pollutants that mainly that of the poly and propyl alkyl molecules that affect the endocrine system as well as the immune system. Once these systems are affected with that of the growing amount of pollutions in the environment, probably human life is going to be affected in all the way. Not only that of the reproductive way, meaning that of the male and female, that of the spermatogenesis, that of the oogenesis, that of the follicular growth, granulosa cell concentration, ovulation, all these are affected. So to my mind, this awareness is important, and we need to work upon. We are mostly getting the data that you will see. Once I have got this information knowledge of all over the world, But in Indian perspective, apart from the gas tragedy of Bhopal thereafter, we are having little bit of information. So we need to have more information in our country-based study so that we know the protective measures and we can improve our situation that I was talking to you. I think this is to start with. I wish this program a grand success, and I wish this awareness grows on to all the society, not that of the RCOG, also that of the FOXY. Thank you.
Thank you very much, Dr. Konar, for really giving us inputs into the pollutants which are really affecting our lives, and the great work you are doing on pollution, and you're writing articles and making people aware about it. And really, really thank you for coming on our program. And we would like to, go ahead with this environment thing on different platforms as well. We are doing it on ISAR, and we will keep talking this topic on different platforms. So thank you
Sure.
very much, Dr. Kunar, and I think we can go ahead with the further program, Dr. Rupali.
Yes,
You can
thank you.
invite our chairpersons for the
Thank
talk.
you, sir. Thank you, ma'am. Thank you very much. Can we have Dr. Reena Bamni, ma'am, and Dr. Amay Purandare, sir, CV? Dr. Brutula?
Good evening, all. So it's my privilege to introduce Dr. Reenavani Madam. Madam is the chairperson for the today's lecture, and Madam is a professor and head of Department of OBGY, HBT Medical College and Cooper Hospital, Mumbai. She was president of Mumbai Breastfeeding Promotion Committee from 2019 to 22. She is also a member of ICOG Governing Council from 21 to 23, and she has been on different committees of FOXY in the meantime, that is from 2015 to till date. She has been
Thank
author
you.
of
I
two
think that's
texts.
enough. I'm happy to be here as chairperson with all this august audience, and let's get on with the.
Thank you,
Yes,
madam.
please.
Welcome, madam.
Yeah, we also like to welcome, and it's a privilege to introduce Dr. Amay Purandare, sir. He's a storehouse of knowledge. We all know that his presentations are very crisp and very up to date. Sir is a consultant obstetrician and gynecologist in Mumbai Purandare Hospital. He's a senior vice president of AMOX, joint secretary in FOXY. He's also the chairperson of the Food, Drugs, Medical, Surgical Equipment Committee of FOXY, and sir is a recipient of many awards. He's a peer reviewer, Journal of OBGY of India as well, joint clinical secretary and mentor of Youth Council Moms as well. Sir, welcome on board. Thank you very much for accepting our invite. And we let one of the chairpersons introduce the speaker today for the talk, Dr. Archana, ma'am.
Thank you, Rupali, for those kind words. And indeed, it's a privilege to be there on this platform. I'd request Dr. Reena Vani to do the honors with respect to introducing Dr. Archana Basal.
Thank you. It's a pleasure and privilege to introduce Dr. Archana Basair. You can see her degrees. She's been very active with the RCOG. She's a Guinness World Record holder for removing the largest uterine tumor. But she has worked with all the different organizations in our country, VP FOXY 2020, MP ISAR chairperson, ISPA joint secretary, and fellow representative of RCOG West Zone. She's also a very dear friend of mine and has done great work in imaging. She's a very hands-on practicing gynecologist along with academics. And I'm sure she's going to really give us a very good insight into impact of the changing environment on fertility, just at the heels of World Environment Day, which was just is going on. So over to you, Archana, and we are looking forward to hearing your words.
Thank you, Reena. Thank you, Amay, for a kind introduction. So let me be allowed to share my screen. So good evening again. So what I'm going to be talking about is climate change, pollution, and fertility health. We all are aware the impact of climate change is the biggest health threat of the century, and we all are witnessing global warming, heat-related illnesses, cardiovascular diseases, respiratory diseases and asthma, zoonotic vector and waterborne diseases, mental and neurological disorder, and injuries and death. Now, if you look at the pregnancy and climate change, what does it causes? You are dealing with an increasing number of preterm births, low birth weight, stillbirth, and effect on the brain development of the fetus. So, roadmap of my talk is pollution, and we should look for solution. So, effect of pollution on fertility. Our key concerns are our three essentials: water, air, and food. They are all polluted. Environmental toxins, how they disrupt fertility, I'll be talking about it, and our role in solution as an organization against the pollution. So let me introduce with the to all of you to the problem which we have in hand. It's an increasing number of couples are finding conception more difficult. Approximate incidence is 7 to 10%. All of us who have been practicing obs and gynae, we are noticing that more and more couples are coming up with the problem of not being able to conceive. The research is quite clear that metals and chemicals in air, water, food, and health and beauty aids are damaging fertility in many ways. These toxicants are causing men to experience relentlessly decreasing sperm counts and function, and while women are suffering progressively worse anovulation, impaired implantation, and miscarriages. Environmental toxins and infertility, they are endocrine disruptors. They damage the female reproductive system, they damage the male reproductive system, and impair the fetal viability. This damage by the environmental toxin is not only decreases natural fertility but also makes IVF much less likely to succeed. Now, how do the environmental factors affect fertility? Whatever we are breathing has lots of pollution because of the industrial pollution. There is a vehicular, because of the increasing transportation, the pollution coming from there, pollution coming from all around us. And there are toxins in the environment, even in the cosmetics, even in pesticides. Everything we are facing has the problem. Endocrine disruptors, the key endocrine disruption impairing fertility is loss of blood sugar control, manifesting clinically directly as metabolic syndrome and diabetes, and indirectly as abdominal obesity in men and PCOS in women. Women with PCO, we know that lower fertility, they are more prone to PIH, GDM, FGR, preterm births, NICU admissions are increasing, and there is an increasing perinatal mortality in this group of women. There are chemicals which are causing infertility. As a woman's blood level of hexachlorocyclohexane, polychlorinated bisphenyls, and DDT increase, their fertility goes down. Women with highest level of PCBs have a serious 50% decrease in their ability to get pregnant, and if they become pregnant, they are much more likely to miscarry. So when infertile couples seek IVF, those with the highest level of PCB were much more unlikely to achieve pregnancy. Or even the water we are drinking is contaminated. So non-occupational exposure is much more common and is clearly a problem. Women drinking groundwater with tetrachloryl ethylene contamination suffers over a doubled risk of spontaneous abortion as well as increased risk of breast cancer. Now, how does the water get contaminated? Chlorination of drinking water was a huge public health success, but also caused some unexpected problems. This method of disinfection typically produces 4-trihalomethane compounds chloroform, bromodichloromethane, chlorodibromoethane, and bromoform, as well as other non-THM compounds. Drinking chlorinated water is associated with an increased risk of stillbirth. Women drinking chlorinated water were far more likely to deliver a child with smaller body length and smaller head circumference. Air pollution, if you look at the air pollution, there's an obvious cause of toxin exposure in the air in tobacco use. Since tobacco smoke contains many toxic metals and chemicals, determining which is worst is not clear. Smoking also causes higher rates of ectopic pregnancies and spontaneous abortion, stillbirths, and infant mortality. Cigarette smoking also decreases male fertility, resulting in decreased sperm density, total sperm counts, and number of motile sperms. Air pollution, other problem. The problem is not just active choices, but passive ones as well, such as living near a busy roadways. The closer a woman lives near a highway, the higher her rate of infertility. Even brief exposure to elevated levels of PM10 particulate increases rate of miscarriage. Air pollutants from vehicular exhaust are also associated with reduced fertility in males as well. Men residing in industrial towns suffered significant reduction in sperm motility and morphology and higher levels of sperm with abnormal chromatin when compared with those living in a rural district with little air pollution. Is your food safe? This presentation reveals just the tip of the icebergs of toxin induced infertility. Simply consuming food with a high pesticide level is enough to decrease fertility by a surprising amount. We need to become aware of how common environmental pollutants impair health and increase incidence of virtually every disease. Damage not only decreases natural fertility but also makes in vitro fertilization much less likely to succeed. The worst fertility disruptors are organochloride compounds, chlorinated pesticide, polychlorinated biphenyls and dioxins, bisphenol A, and organophosphate pesticides and herbicides. There are many other chemicals, metals, and air pollutants seriously damages fertility. So the risk of infertility is progressively escalating over the years. It has been established that exposure to environmental pollutants is closely linked to infertility. Now is our time to point the way to a brighter future. Our ideas, collaborative work, and innovative mindset will lay the path for all fertility specialists and our patients to follow. What can OBGYN do? The first and foremost important thing is be informed. We ourselves need to learn, understand, and educate ourselves that yes, there is a pollution and there is a problem in the environment which is causing a problem, and we need to advocate this from different platforms like organizing webinars, organizing meetings, public forums. We need to advocate it right by writing the articles in the newspapers or journals that yes, we really need to look into this seriously, take it seriously, and we need to really uh, have some role in the research as well, that what particle is causing the problem. Small things can really help in reducing the pollution and can help with the environment. We have to prevent all this from happening. We as a doctors, we as a medical community ourselves are really generating even the lot of disposables, and that is also causing a lot of pollution. So small steps we should all say. The charity begins from home. We ourselves are going to reduce the pollution and will help the environment. So what can we do? We can advocate for policies to prevent exposure to toxic environmental chemicals, work to ensure a healthy food system for all, make environmental health part of healthcare. We have to educate our patients when we are even counseling. Then if they are smoking or if the partner is smoking, we really have to give 1 or 2 minutes extra to talk to them and talk through to them that yes, you have to reduce, you have to stop smoking for yourself, for your pregnancy, and for your baby, and for the whole population as a whole. Make environmental health part of healthcare, like FIGO is doing, AOFOG is doing, Foxy also has come up with environmental committee. All are working for the betterment of environment, and we actually have started at MPSR as well. When I took over as a president and Braj as a secretary on 2nd of March, we had our theme this year that we are going to look into the environment. And yesterday only we have launched our e-newsletter on environmental health and how to reduce the pollution. And this is a publication in the Jogi by even Dr. Krishnendu Gupta, Foxy Environmental Health Committee 2024-2025. And Dr. Konar's article was also there. What other obs and gynae are doing? A mangrove to improve. Plant one tree for every newborn and soon to be born. This is the theme which we have adopted, and I think we are handing over the plants to our patients and our would-be mothers and those who are getting from the hospital, discharged from the hospital. At the time, we are giving them and we are educating them and telling them, yes, though it's a small tree, but plant it so that it will give you a little bit of a fresh air. So it is very, very important that knowledge, attitudes, and perception on environment, health effects on pregnancy amongst all our members is very important. So a journey of 1,000 miles begins with a single step. Lao Tzu said. So our solution to pollution is we all should start looking into the environment. We all should plant trees and have a more greenery, more clean air for ourselves. I think as member of our society, we all can do. We in summary, investing in health of women is investing in health of current and future generations. We as an obstetrician gynecologist are providing care for individual patients, guiding women's health services, leading global efforts to reduce maternal morbidity and mortality, reducing cervical cancer, directing global fistula programs. We are championing reproductive health access, eliminating exposure to toxic chemicals, or being a voice in the fight against climate change. We are uniquely qualified to advocate, teach, and provide research on behalf of women. So I would like to thank everyone for patient listening, nasal nurture, and nature in the art. This is a very beautiful logo designed by one of our member of Indore Obs Gynae Society. So thank you. And if there are any questions, I think there's a beautiful panel ahead. So I think all our members, I would say our members are doing for the pollution. They are growing the organics, organic farming are doing some members. Many are using the electric vehicle. So I think a small steps can really help and work towards improving our environment for ourselves, for our future generation, and for population in general. So I think this is high time we should look into environment, environment, and environment. Thank you very much.
Fantastic talk, Archana. And I think she's given a very clear message that, as Mahatma Gandhi has said, we must be the change we want to see in the world. And in fact, Gandhiji had also said that the earth has enough for every man's need, but not enough for every man's greed. So we have to learn how much we need to take from the environment, be conscious, be simple. A thing like our own MOGS has stopped making print copies because each sheet uses so many trees. So let's be the change we want to see. And over to you, Amaya, for your comments.
Yeah, so I think Dr. Baser has highlighted a very important aspect that just like a lot of lifestyle related diseases are affecting fertility and reproduction and pregnancy outcomes, climate change also is affecting it in a big way. Probably we are not highlighting it to that extent. Probably we are not advocating it in a big way. And I think as doctors and healthcare professionals, we must live by example and we must bring about this societal change. Also, while counseling our patients, especially about the use of various pollutants, we must be very proactive and explain to them what they should do and what they should not, especially in the industrialized cities or even in areas where there is a high level of pollution. We read in the papers all the time that the air quality index of this city is bad and that city is bad, etc. We need to make our patients aware about this and take the necessary precautions. But overall, I think that climate change is going to affect future populations, and it is not to blame X, Y, or Z, but we need to ensure that we act positively and bring about that change. Thank you once again, Dr. Baser, for opening our eyes, our minds, and hopefully our will to bring about that change. Thank you.
Thank you, Amay, for your kind words and inputs. I think this is the time we should all act together for our environment. So thank you very much. And over to you, Rupali, for
Yes,
taking the thing further.
yes. Thank you very much, madam. It was really an amazing talk, and this is a very what you call neglected topic, if I can say. Like, we're not really putting a lot of efforts to look into this. It's a very subtle thing which is keeping on going on everywhere, and we really, it's high time that we need to, pay attention to this. We now move forward for our panel discussion, and I would ask Dr. Archana ma'am to introduce our moderators. Madam, can you please introduce? Can we have the 2 slides? Thank
Hi,
you.
it's my proud privilege to introduce my dear friend, my colleague, and secretary of MP, sir. Yeah, I think I lost you guys. Yeah, but
I think I lost you guys.
but I'm again. Hello, can you hear me?
Yes,
Ma'am,
ma'am.
you are from 2 devices.
Because I was in between I was not connected on laptop, but now it's okay. So Dr. Tiwari is chairperson Foxy Environmental Committee. She's secretary MP ISAR, and she's secretary of ISOPA, past president Indore Gynae Society. I think above all, so many posts and whatever she does academic, she is a down to earth person with a ever smiling and ever helping and ever yes for everything. So Braj, welcome to moderate the panel. And can I have the CV of the Dr. Padma? Padma is a very great friend. I think we have connected way back since 2000 when I went to Kolhapur for one of her conferences. She is MRCOG, FICOG, Clinical Research Fellow in ART from University of Glasgow. She's is she was chairperson of Maharashtra chapter of ISAR. She is 2023 to 2025 president of Fertility Preservation Society, chairperson Maharashtra chapter of ISAR, immediate past editor in chief Journal of Human Reproductive Sciences, and deputy editor of Fertility and Reproduction, official journal of Asia Pacific Initiative in Reproduction. And she's a great academician, and she has done so many publication and research. I know that she will go into the depth of the subject. Whatever work she takes in hand, her commitment is always 100%. So I'm looking forward to this great panel by Dr. Padma Rekha and Dr. Brajwala. And please take the dais and introduce all the panelists.
Thank you, ma'am.
Thank you, Archana. Thank you, Archana.
Can we have
Thank you so much, madam, for giving us opportunity. And I must say, madam is the right leader for future, and best wishes, madam, for your future endeavors, because you're working so hard and so meticulous. I'm working with you for as the secretary MP SAR, and I'm closely seeing how much dedication you are having for everything, and you are doing everything so meticulously. So best wishes, madam.
Thank you, Brajbala.
Can we have Dr. Mridula to introduce the panelists? Dr. Mridula, please.
Yes, good evening, madam. So, we will introduce our panelists for today under the able leadership, moderatorship of Dr. Brijbala Tiwari madam and Padmarekha madam. So, our first panelist is Dr. Preeti Poge. She is MBBS DGO and MRCOG. She is a member of European Society. She has done her fellowship in infertility laparoscopy, and she is now consultant and owner at Preeti IVF Jalgaon. And she also is owner and mentor for this MRCOG goal, which conducts coaching for the MRCOG aspirants. So welcome, Dr. Preeti. Next.
Thank you.
Yeah. Also, let me have privilege to introduce Dr. Rupali Dharwadkar. She has done her MBBS DGO and MRCOG. Also, she has done her fellowship in infertility. She is consultant at Surya Hospital, Mumbai. Criticare Hospital, Mumbai, and she has special interest in IVF and infertility. She is a member of West Zone India IRC committee. Welcome, Dr. Rupali.
Thank you, Dr. Mridula.
Yeah. Now I would like to introduce Dr. Surya Malik. She is MD, FRM and MRCOG. She is having advanced diploma in ART and reproductive medicine. She has lots of awards and lots of publications on her record. Welcome, Dr. Surya.
Thank you, ma'am.
Yeah. Yes. Then I would like to welcome Dinesh, Dr. Dinesh Vade. He has done his MS, DNB, MRCOG. Also, he has finished his fellowship in reproductive medicine. He is consultant IVF specialist in Progenesis Fertility Center in Pune. She was faculty at various conferences of AMOX and AICC RCOG. So, welcome, Dr. Dinesh. Next, let me welcome Dr. Sunita Gopte. She is MBBS DGO and MRCOG, and she has fellowship in reproductive medicine. She is consultant as fertility specialist in various hospitals in Thane, that is Vedanta, Curai Fertility Center, and Ved Multispeciality Hospital. Welcome, Dr. Sunita. Also, let me welcome Dr. Sheetal Pandey. She is MS, DNB and MRCOG. She is consultant in the fertility consultant at Veda Care since 2015 and Wokard Hospital at Mira Road. She has special interest in the fertility and IVF, and also she has special interest in repeated implantation failures and male infertility. Welcome, Dr. Sheetal. Then let me introduce Dr. Archana Ropade. She is MBBS, MS and MRCOG. She is a vice president. She is from Karad. She is vice president at Karad Obstetric and Gynecological Society, and she is working as assistant professor in Krishna Medical College, Karad. Welcome, Dr. Archana.
Thank you, Dr. Mridula.
Yes. So over to you, Dr. Padmarekha Madam and Vishwala Madam, for the moderation of this panel.
Thank you very much. Good evening, everybody. We have a fantastic panel here, and I would like Brijbala to kickstart the whole session.
Yeah. So, will you be sharing?
Do you want me to share? Yeah, I'll do that.
So, very good evening to everyone. Yesterday we had World Environment Day. It's not the single day. We need to take care of our environment every day. And being chairperson of Environment Health Committee, yesterday we had started Green Initiative, and plantation was going on from last Sunday, and it's going on. And we know the pollutants are everywhere. They are ubiquitous, or they are geographical according to the place where the person is staying. So we are exposed to air pollution, water pollution, microplastics, heavy metals, smoking, and mycotoxins. And there are many organic pollutants as well. So we are not having only air pollution, water pollution, radiation pollution, e-waste, and noise pollution is also causing a lot many ill effects on human reproduction and a long-term toxic effect on the future generation. So we have the environment. We know Jal, Prithvi, Vayu, Akash, and Agni. There are 5 elements, very, very important for any living organisms. But we are contaminating everything by the modernization, industrialization, and not taking care of these important elements of our life. So we are contaminating water by pollution. We are contaminating air by ozone and all that. We are contaminating our soil by metals, pesticides, ozone in the sky. So we are contaminating everything by these things.
So I think, Dr. Brajbala, I just wanted to add, I think Dr. Mrudla has kindly agreed to be a panelist instead of Dr. Jyoti, who could not be here today. So I think, Dr. Mrudla, you're very much here, and thanks for accepting this last moment change. And in addition to what you have highlighted, I think we also need to look at the microcosm of intrauterine environment as well. So where, the fetuses of mothers exposed to all that, so very beautifully you highlighted, start off their life with the negative impact of all this environmental pollution. So I think that is another dimension as obstetricians, we need to really be thinking of. So I think we will start with, I know Archana very, very beautifully said about the positive steps we can take to negate the effect of environmental pollution. But I think there are hurdles here as well. So I would like to ask our panelists, we'll start off with Dr. Dr. Preeti. Um, Now, coming to all this organic farming and trying to sort of depollute, avoid the pollution, have we really achieved our goals? What are these mycotoxins? Has global warming on one side, trying to negate the effect of whatever we are trying to improve? So, what's the effect of global warming on our food chain? Can you highlight this, please?
Hello, ma'am. Thank you very much for inviting me to this panel. Mycotoxins are secondary metabolites produced by fungi, particularly those from Aspergillus, Fusarium, Penicillium. So they can be found in corn, nuts, grains, and they can contaminate the food either during growth, harvest, storage, processing, and they can of course affect the reproductive system and can also affect kidney, liver, can cause immunosuppression. So of course they are causing hormonal disruption and affecting a lot of reproductive health.
Yeah, it is
uh,
just, like amazing how these things which we are totally unaware of can be affecting our health. So, Dr. Mridula, can you just highlight what are these dawns? What is their impact on male fertility to start with?
Yes, thank you, madam, for the question. Actually, DONS, it is a deoxynivalenol. It is a mycotoxin which is derived from fungus, mainly with a Fusarium fungus. And even this seems to be a newer thing, but it is present, in most of the grown crops like wheat, maize, barley. So this is present in as contaminant in most of the crops, and also it is found in regular food items which we consume, like soy sauce, eggs, meat, poultry, and also in beer. So this has a specific impact. Studies have shown that it has got specific impact on male fertility. It particularly disrupts the blood testis barrier. So it causes some abnormal tissue changes in the testicular and epididymal tissue, which affects the spermatogenesis also, and which affects the semen parameters qualitatively and quantitatively. And also it has got some ill effect on this hypothalamo pituitary gonadal axis, so which decreases also the testosterone levels. So that's why it has got a very bad effect on this male fertility, and which usually results in the decrease in the semen parameters, ma'am.
Thank you. So thank you for so beautifully enumerating, the multitude of effects, negative effect on male fertility. And this is just a diagrammatic representation of just in spermatozoa, the sensitive areas which are prone for damage and consequence of infertility. So I think now Brijwala will take us through a very important case scenario.
So after initial discussion, we are coming to some cases in which we are seeing in day-to-day life, but many times we think that it is unexplained or it may be idiopathic. So here is one 28-year-old woman from rural agriculture community, and she presents with a history of 3 consecutive miscarriages in first trimester. And she had been like, we are doing after 3 miscarriages, we are doing everything including hormones, sonography, male factor, genetic testing, and everything comes to be normal. Other women in the same area, when we take history, do you have any family history of your mother is having or your sister is having? So they come out with their is similar history difficulty in conceiving or experiencing similar pregnancy losses. So just want to ask, is recurrent miscarriage can be due to pesticides, and like this recurrent pregnancy loss can be due to pesticides, and what particular chemicals? Can I ask to Dr. Rupali this question?
Yes, ma'am. Thank you very much for this question. This is very important that we become really aware of what is happening in today's world. So most of these pesticides which we see are different types, like we have the OCPs, which we call it the organochlorides. Then we have the OCPs, organophosphates, pyrethroids, carbamates. These are a few of the pesticides which are used. And OCPs, in OCPs, we have this DDT, which is not used most of the times in most of the, developed countries, but we still are using DDT, lindane, which is HCH. And other OC organophosphates are like those malathions and all. These are also an Indian RPL, recurrent pregnancy loss studies, which were done. They also showed that these OCPs and OPPs have contributed to increased recurrent pregnancy loss. Sometimes I just was reading and I came across this Arizona study also, which was showing that, first trimester exposure can also lead, it lead to an increased stillbirths as well. Then moving on to other pesticides, like we have this pyrethroids. They can act as neurotoxins, permethrin and all. So these are, I think, are the various pesticides exposure, and they do lead to miscarriages. And these are the chemicals of, concern for us. The way they do it would be like, by disrupting the hormone signaling, oxidative stress, maybe, some immunological effect like cytokine balance they may be putting off. So these are the different, maybe damage to the DNA also, and disrupt cell division. And these various ways they come, and then they lead to these miscarriages.
Definitely, very rightly said by Dr. Rupali that they are damaging cellular metabolism. Like Dr. Konar already said that it is the protein metabolism, lipid metabolism, cellular metabolism. These are affected by these pesticides, and this particularly DDT, which was once got Nobel Prize, but it was banned very soon because of its toxic effect. But still, in Indian market, in Indian agriculture practice, it is used, and it has a very long half-life, 25 years. So in India, there is no quantitative measurement how much pesticides, how much insecticide should be used. I just ask people coming from rural area, how do you calculate? They just say we are just throwing, just spraying, how much quantity, how frequently it should be used, and they are keeping in their surroundings in their household, and they get exposed to air and they contaminate their water, air. So by all these mechanisms, they are causing ill effects, and we think this is unknown etiology. RPL is due to not because of any reason, but this can be the hidden cause behind this. So coming to Dr. Surya Malik, yeah. Can we prevent it? How to conceal, and what are the precautions one can take during to avoid the exposure, to avoid the uh, ill effects of these chemicals?
Ma'am, such sort of like people who are adding in the, I mean, a farm worker, they for them we should do implicational counseling, support counseling, and therapeutic counseling. Basically, information gathering and then assessment to be done. Working in such a atmosphere, we know that they are continuously exposed to biological, physical, and chemical hazards. So, if we tell them regarding the potential risk regarding this condition, I mean the risk of infection and the risk and the further risk of infertility and the chances of other problems they are going to face in the near future, and that is very important. They should know about, that they are living in an atmosphere that is not very healthy for them. Secondly, we should tell them regarding the safe practices, how to prevent these things. Like we should tell them regarding PPE, personal protective equipments, regarding the use of the gloves, mask, eye protection, regarding reduction of the exposure timing, and then safe storage and disposal of all such chemicals to prevent the leakage and spills is also equally important. Then ventilation, proper ventilation in closed spaces where chemicals are handled. So these all things we can do in such a population to prevent the further, like losses, or to prevent further any harm to such population, because as we know they are continuously exposed to such conditions.
Very rightly explained, Dr. Surya, because many times patient question us why we are aborting so frequently. Doctor, you have got everything done. You have advised whatever test we have done, but still we are getting recurrent pregnancy loss. So we need to counsel women regarding this. We need to prepare ourselves also. And there are many studies that these pesticide, insecticides causing HPO axis disruption and infertility, RPL, and there are not only female infertility but male infertility is rising because in this agriculture workers, so we need to care about this. So I think over to Dr.
I
Padmarika.
think this actually was covered. So I mean the list appears to be endless, Brijwala, what damage it can do. Now coming to another set, we all this sort of endocrine disruptors or EDCs. One of the most commonly talked about molecule is bisphenol A. So how is it linked to female infertility? What specific conditions have been found to be associated with such exposure? Dr. Pinky Shah, I would like you to highlight on this aspect. Dr. Pinky, is she there?
I think she's not there, ma'am.
Okay, Dr. Dinesh, would you be able to take this?
Yeah, very good evening to all, and thanks a lot for this wonderful question. So bisphenol A is such a chemical. It do have the impact on the oocyte quality. It do have the impact on the steroidogenesis, and that will lead to the complications that is having the low variant reserve, diminished variant reserve, and they do affect the fertility outcome of such conditions, and that will lead to the infertility related complications in upcoming phase of time. Talking about a common sources of bisphenol A, it is a chemical which is present in a plastic food containers, a canned metallic container. It do present in the thermal paper receipts. It do present into the dental peeling cements where it do comes. But as per the research commission, it do says that it has been banned from 2020 onwards. But yes, these are the ways where this bisphenol A do come. And yes, again, it is the chemical which affects the steroidogenesis and hormonal proliferation, and it do affects the fertility outcome by means of affecting the oocyte quality and ovarian reserve.
So I think, I mean, it's a paradox in itself. From endometriosis to fibroids to PCOS, it's been linked with various conditions. And I think, I mean, in our country, probably the most visible source are those overhead water tanks made of plastic, exposed to very high temperatures. So we may remove all plastic from our immediate environment, but the soil, from where our food is grown, already is getting water from this source. And I mean, it is just mind-boggling and very frustrating to think that. I mean, I just have to say that the day I decided I'll get rid of plastic from my refrigerator, 2 years down the line, I still haven't been successful. Like especially the day I come home late and there is nobody else at home, I would find the home staff already, having nicely packed everything in plastic boxes and kept. So, I mean, it is just how, from very safe living practices we had in probably 60s and 70s and maybe in up to mid 80s has changed so drastically to something which is actually being harmful to us. So I think this is one another area, I mean, we need to be aware of. And as you very rightly said, similar to sperm, there are multiple susceptible areas in the oocyte which can get damaged by the effect of various environmental pollutants. So that is something we need to be aware of. So, I mean, at this juncture, I know we are not very much deep into the discussion, but I really would like to ask Dr. Sunita, I mean, there are, like Dr. Brijwala said, some of them are geographical, maybe, or occupational, and we can try and see whether those things can be moved away from our immediate environment. But there are some which are ubiquitous. We are all living through, we have to live with these pollutants around us. So are there any remedies available for countering the effects of common environmental toxins on fertility? Do we know of any such things? Dr. Sunita? She's here, but
Is here, ma'am. She is here.
Dr. Sunita?
She appears to be in this, ma'am, in the meet. I don't know, she can't hear.
Okay, maybe Dr. Archana Rokte, would you take this question?
Yeah, sure, ma'am. Thank you for the opportunity, ma'am. So basically, we all know that pollution is a part and parcel of life. It's very difficult to get completely rid of it. But there is a rule of some micronutrients or some chemicals like antioxidants, which can be a part of daily supplements, which might negate the effect of this pollutant on the genetic expression as well as on the for reproductive system. So antioxidant like vitamin A, vitamin C, CoQ10, all these might help. Now, most of the trials have suggested it, but there is no robust data which will support or emphasize on the continuous use of this antioxidant to negate the effect. Another thing that we can use is having a very good diet, which is most of the time organic and most of the time free of pesticides and rich in the micronutrients as well as rich in the antioxidant like fiber rich diet or citrus fruits. All these might help to negate to some extent. At the same time, the avoidance of strategies like exposure to the chemicals, like people who are working in agricultural field, they can use personal protective devices so that they can get protected from the exposure. And even if they get exposed, there we and from that, that might, but most of the that you use are
Yeah, I think, it's really important that prevention and protection both are very important. So thanks for highlighting both the aspects. And I would like to ask Dr. Brijwala to now discuss yet another commonly encountered scenario.
So, coming to case scenario, 132-year fisher woman. She is gravida 2, para 1, and that is IUD and one congenital affected child. She comes to our clinic, and when we are taking history, we need to take her residential history, her occupational history, and she is from seashore, and she is giving there is no genetic history in any of her family, maternal, paternal side. None of the child in her cousins or sister, brother having any congenital disease. So, by this history, what are the problems that she could that could be faced by the future generation? And like to ask with Dr. Prachi.
Dr. Prachi is not there.
Not there. Dr. Prachi is not there, ma'am.
So anyone can take Dr. Rupali or anyone? Dr.
Yeah.
Indranil Jadhav, sir.
Yeah. Excuse me. Sorry to interfere. I forgot to introduce Dr. Indranil Jadhav. He is also one of the panelists. He is fertility specialist and consultant in fertility consultant in Nova IVF Kolhapur. So welcome, Dr. Indranil. If he can take the question.
He was not keeping well, but he did say he would log in. I was not very sure whether he's there.
Yeah, I am there actually.
Okay, great, sir.
Bear with me a little. Thank you for the kind introduction. Actually, heavy metals are bound to actually cause congenital anomalies in the babies, or sometimes there can be genetic mutation, point translocations, or some may not manifest now, but when the child grows up, they manifest. So we should be in condition to actually avoid these heavy metal exposures in the fisherman community. So actually it causes a long-term damage by disturbing the microenvironment, and during the cell division there are many problems which are causing long-term genetic problems to the baby.
So basically, the women living near any water resource contaminated by industrial toxins, industrial waste, not disposed of properly and directly into the water bodies. So there may be heavy metals. We know heavy metals are required for cellular mechanisms, but in trace amounts only. But the high contents of mercury and lead, particularly mercury, the methyl mercury levels were studied in some research, and they found the level of methyl mercury was found in the children born to women residing in these area up to 6-7 years, and they are causing neurological issues in the children and congenital heart disease as well by these heavy metals, particularly mercury and lead. So this is definitely a very important factor for all health issues, particularly reproductive outcomes, not only for during pregnancy but for the future generation. So can we have someone? So this is already done. And do we have Dr. Sheetal Pandey here?
Yes, ma'am, I'm there.
So, Dr. Sheetal, could heavy metal exposure from contaminated fission water be causing the congenital anomalies? And what interventions can reduce the health risk in fishing communities?
Yes, ma'am. Thank you, everyone. So, about the heavy metal exposures, as it has been found that the most of the industrial plants, etc., letting their weights go into the sea waters and leading to more of mercury and high level of lead in the water, which has been found to be definitely affecting the people who are consuming it, and there was evidence of some amount of congenital anomalies which can be found, and also repeated miscarriages. So as far as intervention is concerned, primarily for the population who is actually staying at the seashore, and there is a definitely there is drainage of the uncontrolled drainage of the factories and all, who may be increasing the heavy metal exposure, they need to be knowing about it primarily, especially people who are trying to consume, maybe more aware about it. They can be informing the same to their health professionals. If required, their serum levels can be done to ascertain the thing. And more than that, it would become more an authority related issues, where they will have to be aware to even reach out to the authorities to see to it that the sea level, the heavy metals are in control, and the nearby mills or the factories are not really draining the things. And especially another important thing is the lead free petrol, which was leading to maximum amount of lead in the sea waters. So there was a time back in then, there was a lot of control over it. I failed to actually know what exactly is the situation in our country at the moment. So this way it would reduce the thing, and definitely timely intervention and measurement of the sea levels water for the heavy metals. This would actually go with the authorities, where people will have to be more aware and demanding about it.
So thank you, Dr. Sheetal. Basically, it is the strict regulation need to be formed by government, and government will form regulation only once we are aware, we are making our people aware, and through Foxy and through other bodies of our like medical association need to go to government. And I was asking, just discussing with one IMA office bearer, and they said they are making some approach to government to put it into the their regulations, and then only till that we need to make our patients aware. We need to give pre-conception counseling. If they already had this thing and they are residing in that area, then we can just ask them to stay away from that area for some time till they become pregnant and they deliver baby, to get proper uncontaminated water and all that. Thank you so much.
Yeah. So I think, you highlighted the importance of advocacy, Dr. Brijwala, very well. Unless that advocacy happens from the right organizations and put it across in the right way, in a very effective manner to the government, always the decisions taken by governments have far-reaching effects. So, and it is most difficult because on the other side, there is lobbying, like very big lobbying that happens with the people who benefit by selling these products. So that versus the citizens' voice. So it's a major, I think, conflict that exists there. But we just have to persevere and do the best. Yeah, so I think you have one very important aspect to address here. what
think
can help?
problems.
So I
Yeah.
think you need to.
If
Yes,
you can ask me regarding role of healthcare professionals, actually the primary task will be to give awareness to the public, to the government, and to the other member of our society that this is a actually major problem. Second is to go for the rules and regulations be amended to be implemented and see if they are enforced or not. Third point will be that we can go for research for the existing alternatives, which we can see that less amount of exposure is there and the same benefit is been advised. And after that, we can collaborate with other key organizations to implement this. Last thing will be the newer ones who are coming into the field should be educated as their training module that these are the environmental hazards. In such way, healthcare professional can be of use for these kind of to prevent these healthcare hazards.
Thank you, Indranil. So now I think we'll move to another area of concern, that is air pollution and fertility. Dr. Preeti, there is a lot of talk and work that is going on about particulate matter or PM 2.5. Can you just highlight what effect it has on female fertility and what evidence exists at present? Dr. Preeti is, hello, Dr. Preeti is there? Or Dr. Surya can take this.
Hi, ma'am. Yeah, female fertility, definitely air pollution is an alarming problem these days. Definitely it has a I mean very disaster effect on the female fertility, the quality of the oocyte, and regarding the reproductive capability, regarding the chance of infertility, they all are increasing due to the massively increasing air pollution in the urban cities, we can say. So definitely they have an influence on the female fertility in all the way, we can say, starting from the gamete ending to the embryo. They prevent the proper cleavage of the embryo. They reduce the implantation potential. So definitely the air pollution is really I should say it's a real hazard for the female fertility nowadays.
Thank you. Dr. Dinesh, would you address what effect this has on male fertility? Again, like is it a targeted effect on the male gamete, or does it have a more widespread effect on the general health as well?
Definitely, as these particulate matters are there, definitely having the ill effect on the lung, the cardiovascular, the system of our body. But talking about more in the context of the male infertility, because of this generate the more oxidative free radical in our body. And these radical do affect the sperm function. Very importantly, that do affect the natural way of conception. Along with that, even if we talk in the context of the ART, in that context, yes, sperm DNA is very, very important, which is getting affected because of this oxidative stress. And that's the reason this particulate matter need to be controlled in the context of male fertility, where the sperm DNA, which is really very important from the conversion of day 3 to day 5 embryo, that is blastocyst transformation. And that could be sometimes is the sperm DNA which leads the genomic activation, and that could increases the further chances of miscarriage in the phase of time. So definitely on the male context, yes, it is very importantly affecting the DNA, the sperm morphologies, and the sperm parameter and the functions.
Thank you.
So basically, that particulate matter is everywhere nowadays, and in some cities it is so high that people need to keep the air purifier and all that. And rising rates of male infertility is like anything in last 2 decades. So we need to be careful about this particulate matter. So coming to third case, and she is 30-year woman with history of irregular menses and frequent headache. She is a beauty salon employee, and her complaints can be connection with her profession and her this complaints and profession. Is there any connection between this? I think Dr. Rupali or anyone can take this.
Ma'am,
Should I take
Mrudula,
it?
yeah, yeah, I can take this. We have seen that today in beauty parlors also, we have been having a lot of these hair treatments, facials, nail paints, and all these are chemicals. And a lot of chemicals are being used, and the fumes which are generated because of this hair straightening and all, these are the real causes which can lead to some kind of, chemical loads in the body, which we can say. And the hair treatments, we especially see that formaldehyde is used, so those fumes are bad. And I feel that some of these can lead to some endocrine disruption in the body, which can give rise to irregular periods, frequent headaches, and especially because the working conditions are not optimum in India and no regulations are there where a particular chemical is used, and then they have monitored that, they have seen that proper ventilation is there. If all those things were used, probably the effect of these chemicals would be less, but those kind of scenarios do not really exist. And the protective all those personal protective equipments which need to be used when they're using all these in the salons are not given most of the times to these small salons which are there. I'm not talking about the bigger ones. These could be the reasons why this lady must be suffering from menstrual issues as well as these frequent headaches.
So rightly said, Dr. Upali, that these cosmetics are releasing, particularly hairdressers, the cysteine keratin treatment releasing a lot many this formaldehyde, and they are causing disruption at HPO axis, and that is causing to this irregular cycles and increasing incidences of PCOS, endometriosis, and this dysgenesis, cellular dysgenesis is causing a later difficulty in conception as well, because they are very closed area and there is no proper ventilation. And though no there are not, they are not using any safety measures like mask or gloves. So these are the possible reasons with her complaints, and the headache and irregular periods may be because of this. So do we have Dr. Surya with us?
Yes, ma'am.
Yeah. So Dr. Surya, uh, now, like how we can conceal and how do occupational exposure? I think this is covered by Dr. Rupali. Uh, yeah. So, what preventive measures can saloon implement, such as ventilation and all that? Just highlight on this.
Hello.
Yes, Priya.
Hello.
Yes, you
Yeah,
are
we can
audible,
hear
ma'am.
you.
Ma'am, definitely they should be told to use the protective equipments always, and the mask, and to use the gloves when they are and to reduce the exposure timing again, because they are continuously exposed to such environment. So basically, we should tell. Hello.
Next question, Dr. Padma. Next question, please. Yeah. So, do you recommend their screening for occupational exposure? So, seriously, are we taking this history?
Ma'am, actually, to be very frank, before this, panel discussion, we were not so much, into it actually. But now, we have learned so much because of this. Now, definitely, we will take a thorough history of the occupation. This is very true from today onwards, I will say. But regarding it, like definitely a thorough history should be taken regarding the occupation, in which industry the person is currently working. Then secondly, the workplace conditions. Then thirdly, the physical like prolonged standing, heavy physical work, or any sort of like heavy lifting or something. Then chemical exposure, frequency of using. Then symptoms, if there are any symptoms to the person regarding coughing, sore throat, or any teary eyes or something. Then the use of PPE, either they are using the protective equipments or anything, or they are not using this, all to be done. And if we are finding any clue in this history, the blood test or blood test should be done to evaluate the levels of different these things in the blood, formaldehyde or ammonia, if we find any clue in the history.
So basically, is that we can advise them preventive measures, very rightly said, and very correct that even I just started reading a lot about the environmental toxins and pollutants once I took charge of this committee chairperson. And it was surprising for me also that there are so many research, so many literature available, and we used to think this is idiopathic, this is unexplained, and now because we need to get aware ourselves, That is very important.
Ma'am, basically, I will tell you the truth. I mean, it was written dawn, na, so I was thinking, what is dawn? So I have to Google and then
Yes, it has
So we
given us
started off with that Google.
what is dawn before it.
So this is great start on Environment Day. That is very important. So over to you, Dr. Ram.
Yeah, Dr. Sunita, are you there? I think she's.
She is there. Dr. Sunita is there in the.
But I think she's preoccupied with something else. Yeah, so I think, like we at the beginning alluded to, not the macro environment, but there is another kind of environment that is intrauterine environment where we all start where we all of us have our beginnings. What's the importance of this intrauterine environment? Because if as a mother I'm being exposed to all these pollutants from the environment around us, can somebody call Dr. Sunita and tell her to either mute herself or come as a panelist? I think she has left her microphone on and she's occupied elsewhere.
Ma'am, can I answer this question?
Yeah. So does it have any influence on the fetal and child's health?
Definitely, ma'am. As we know about the Barker hypothesis, we all know that the fetal origin hypothesis, that is like proposes that the prenatal environment and the adverse conditions during the fetal development can lead to increased risk.
You're muted.
Yeah. Now it's okay, ma'am.
Yeah.
Yeah, so all we know about the Barker hypothesis, that is known the fetal origin hypothesis, that is truly proposes that the prenatal atmosphere and we say the fetal development can lead to increased risk of the chronic diseases later in the life. So this hypothesis that we know that if there is any suboptimal intrauterine environment, then definitely it is going to lead to low birth weight, and definitely it has a implication in the later life leading to cardiovascular diseases, type 2 diabetes mellitus, or even hypertension. So definitely this is very true that intrauterine environment have an influence on the fetal and child's health.
Yeah, very, very true. So elaborating a little bit more on that, Dr. Archana, can you tell us which is a condition we commonly hear about, having fetal origins? For example, passive smoking, how it affects fertility, and I would like you to elaborate on that one particular condition which is becoming ever so important in the Indian scenario, which has fetal origins.
Yeah, most of this, as this question is basically emphasizing on Barker's hypothesis, and most of the conditions which are attributed to fetal origin, one of common among them is a polycystic ovarian disease. Another is childhood obesity and the metabolic disorders, which can lead to early onset diabetes, hypertension, and cardiovascular risk factors in a very adult life. So all these conditions have their origin in the fetal life, and this fetal life is very fragile, during which the exposure to these chemicals, toxins, heavy metals can definitely cause even the fetal endocrine disruptions and damage to the fetal embryonic cells or a genetic cells like a ovum in a female fetus. So definitely we have to be very much aware about the not only pregnant women, it is not only hazardous for them, but to the babies and to the future generations. Ma'am, coming to your second questions about the passive smoking. Smoking is definitely detrimental for the general health for the any person, let it be a pregnant woman or a non-pregnant male person also. But at the same time, passive smoking definitely affect the endocrine function. It actually decreases the estrogen level and it modulates the estrogen receptors, which can lead to the conditions like ovarian toxicity leading to premature ovarian insufficiency and poor ovarian reserve, and sometimes even IVF success rate is also failing because of passive smoking. So this is about the effect of smoking on the fertility.
So I think we have to run a parallel, like clinic. Somebody sits and goes through this checklist of things. And I think that's a good idea to have a checklist so that we can hand it over to every person who comes. And maybe Foxy can take up this under Archana's leadership and have this as a, thing which we start doing in our clinics for every patient who arrives, at least with infertility to start off with. So thank you for elaborating on that. So now over to you, Brishpala.
Dr. Padmarekha, Can you go back on your question? Just want to add on your question something. Does the effect of external environment reaches intrauterine environment as well? So a little bit some spiritual and scientific. Uh, we have seen the exposure of loud noise when doing sonography. There are some studies. They found that if a loud noise is there, the fetal movements are different, and when there is like
Musical notes.
yeah, so then baby behaves in different proper way, and there are so many spiritual mythological stories as well. So just I want to add on this. We
Yeah,
can add.
yeah. That's very beautifully put. Thank you.
So coming to one more case scenario, a couple reporting with preterm birth due to preeclampsia, now inability to have a baby since 4 years, and they are residing close to coal mine. And so do we have Dr. Sunita? I think she's not available. So anyone, Dr. Archana, Dr. Mridula can take, I think. So what would be the point to be considered on treatment with this history? And what are the risk factors? She's residing near the coal mines.
Thank you for the question, madam. The coal mine, the resident near the coal mine, they are basically exposed for this air pollution and water pollution also. The heavy metal can go in the water pollution, and along with that, in the air, particulate matters will be there. And usually, these things they cross the placenta, and they are responsible for the fetal toxicity and also development of IUGR, and that may result in stillbirths and extremely low birth weights. So for the residents who are near the coal mines, they should basically purify their water and use the purified water only for their drinking and even for other activities also. And also regarding the air pollution, they should use the protective equipments like masks, and so this can help in preventing this placental transport of these toxins, and also will improve the fetal health.
I would, can I add one thing?
Yes, ma'am.
This coal mines, those who reside near the coal mines, because of the environmental hazard, the sperm quality is affected more than the female cause for infertility. Because this is what I had read, so I don't know how far that is true. But it's more to
So,
do with the sperm quality and the production. Spermatogenesis is affected. There is oxidative damage, and that's the reason why, because of a male factor of infertility, the patient is unable to conceive.
So it is basically the male partner is working in that area, and so sperm quality, spermatogenesis, and oocyte quality both are affected, and that is leading to all the reproductive hazards, right from pre-eclampsia, preterm birth, and later on. Continuous exposure leads are very much gametotoxic, and that is leading to her infertility. So the only preventive measures we can do is to protect the environment, and for that we need to do a use plantation in that area, so the air can be purified by natural resources. And for the water, already told by Dr. That we need to be purified by purifier, and not to use tap water for drinking or cooking. That is very, very important.
Just to add on this, it has been mentioned that when there are the coal mines, the temperature conditions are so hot. That's the reason the testicular temperatures become on a higher side, and it has been seen very evidently in the coal mine worker that sperm parameters are drastically getting deteriorated once they start working over there. So I think on the ergonomic point of view, also we should work upon for this.
Yes, very, very important input, Dr. Dinesh. That is really very important. The high temperature exposure of male partner is really very hazardous for the sperms and DNA fragmentation, and that all leading to all these things. So we know that the WHO has come up with the air pollutants. They are like particulate matters and all the ozones and SO, NO, and all that are increased in the level desired for that particular area. That is the so air pollution, water pollution, and temperature. All are the drawbacks in that area and causing to all these ill effects. So can
I
we
think-
go with
Yeah, just quick sort of rapid fire questions. What are microplastics? How do they enter our body? And what are the commonest sources at home? And what about the cosmetics? What role do they play in pumping microplastics into our system? I think Dr. Mridula, would you take this question?
Yes. Yes, madam. Thank you for the microplastics. Basically, they enter through all the very fine particulate matters of the plastic. So they can enter through the plastic food containers, plastic water bottles. So they can enter our body by ingestion. Also through the skin contact. Also they can enter our body. So the plastics we use like plastic containers, food storage containers, when we make food in the plastic, when we cook the food in the plastic, or when we store the hot food in the plastics, or even water, that all can be the sources for ingestion of this microplastics. Even when we are handling the plastics, they can enter this microplastics through our skin. So it is basically it's very difficult to eliminate plastic, as you said, madam, but it is I think that is the only way that how we can prevent the microplastics from entering our body.
Yeah, I think it is ubiquitous, and we can only consciously try and minimize. And I think freezing, I mean, more than refrigerator, putting everything in the frozen section in plastic, it is a lot more harmful than at room temperature, from what I gather. So, and most of the things are stored in plastic in the frozen section, so of the fridge. So that is one area of concern. And coming back quickly to this EDCs, what is the level of awareness that exists, let's say, among healthcare professionals? Forget about the general population. Should we start through organizations? Should we start addressing this? Dr. Dinesh?
Definitely, from organization point of view, we all have to put our one step ahead just because of the patient awareness, because every treatment starts with the patient education. So this awareness will make them going back to the roots rather than using the plastics. Let's go into the more organic way of the lifestyle. That will definitely going to help. And definitely from this current generation, we can say about the Insta, the Reels, the YouTube's videos will definitely help our patient to understand that what exactly these endocrine disrupting chemicals and how to keep ourselves away. Taking 100% out of that may not be possible. Might be one single effort of every person, or might be one single effort of everyone will definitely help. From our point of view, when one of my patient get conceived, we encourage them to put one plant at least for the benefit of another infertile couple. And that's where slowly might be it will be far better that people will understand that why we are going back to our roots and getting more into the organic lifestyle now.
Yeah, that's I think very important input. Thank you.
Yeah, madam, I feel, see, just because this today's topic has come, we were reading about it. But how much of this we even knew before we actually became the panelists, for that matter? That is
So, one of the things we
doctor
have tried to
awareness
do.
is what I think we have to be more aware as doctors first, that there
mean-
exists a problem from these things. More studies can be published so that everyone can benefit from this, and then later on the preventive measures for sure, or
So,
simultaneously.
I mean, what we have started doing in the hospital is all water supplied to admitted patients is through glass bottles. So it does, initially it is an expensive thing to do that, but when it is right, we have to take step towards that. So it's a conscious decision rather than, like supplying in plastic bottles. So we have tried to eliminate plastic where all, and then we have put little notices as to why we have done that. So I think, just putting, and everything verbally impart, but just putting little notices here and there where patients are sitting and waiting for their turn. It can go a long way. More, like Dr. Dinesh said, we have the social media, Instagram, Reels, and so there are limitless opportunities now, and we have to transform ourselves. So now I take water from that. I go to the waiting area and I collect in a glass bottle water there. So when people see that we are doing that, they're reassured that yes, it is good source of water. They don't have to carry a plastic bottle, or they don't have to buy a plastic bottle. So I think that's why I asked that question, that if the organizations we work with and for can give these tips to us, individually we don't have to do. We can embrace that as an organization, as a member of organization. Life becomes so much easier. So when we have very good leaders amongst us, I'm very sure they'll take this up in a very positive way. Indraneet?
Add one thing.
The charity begins at home, and being this committee chair, we are coming with a book, Nature versus Nurture, in that every pollution is described and highlighted, and small steps, like said by Dr. Padmarekha, that we have to stop using plastic bottles even in our conferences. So first we have to make our hospital, our clinic eco-friendly. Our conferences, we have to go to back to basics. Like in my hospital, in NICU, ICU, I stopped using disposable cap mask. We are autoclaving every day.
Yes,
So
that's
small steps can be very we have to go long way.
Yes.
We know it is really frustrating, it is difficult, but we have to be hopeful. We have to make aware ourselves. uh, we have one woman, she is Padam Shri in our Indore. I had an opportunity to do podcast with her. She is zero waste. Her home is zero waste. They are generating electricity. They are not taking anything from outside. They are having, of course, some area to grow food and organic food and everything. So we have to start from ourselves only, and then only we can educate our patient by our example. If we carry in conference our still water, and there are water refill stations, thousands of water bottles which we are throwing in our conferences can be prevented.
Yeah, I think that's very heartening to hear. We look forward to the book. As soon as it comes, please let us all know. Indranil?
I think it is very important what Brajbala is saying. I think this we are doing it in our next conference, Padma. We are doing a conference in Indore, ISAR Embryology, 12th, 13th, 14th of September, where Brajbala has proposed that we should have everything, like a paperless conference with not using the plastic. So we are putting those containers, and we'll be putting the paper cups.
Yeah.
And maybe, as a faculty or as a delegate, just a bottle, a water bottle, or maybe a bottle, so that everybody can carry their own bottles. So we are making efforts. And I was even observing, if all of us are traveling, we know that, even in the airlines, they were used to give the plastic bottles when you ask for the water. Nowadays, they are giving you in a paper cup. Nowhere, even in the hotels also, they have stopped keeping. So I think gradually the change is going to come. I mean, it's a long process, because we all are used to so much of using the disposables and plastic bottles. First, we have to make a conscious effort to really stop using plastic bottles, and ourselves, as all of you have said, that we have to make efforts from ourselves. It should begin from ourselves.
Yeah, I mean, since we have shifted to glass, I cannot drink from, psychologically, it is a barrier. I cannot pick up a plastic bottle. And, Foxy is a very strong organization. If so many tens of thousands of us start that movement, and, especially obstetricians, I think, have a very powerful presence in our patients' homes also, compared to other medical fraternity. So we become part of their, like home life somehow, virtually. So I think, we have that power, and with people like you, standing up for this cause, I think it really will get promoted very beautifully.
Yep. Yeah, I'm sure we really need to get started, and it will get momentum on its own. मैं तो अकेला ही चला था, कारवां बढ़ता गया, kind of a thing, and people will join in. So I
Yes.
think that's what is our aim, and our vision is to really improve our environment.
So I think, at the end of these endeavors, maybe, a quick checklist can be brought into our clinical practice. So to, highlight whatever changes they can do instead of each one of us doing individually, if we can bring it, however primitive it could be, if we can bring out a little checklist which we can hand over to our patients to try and bring changes in their home and office environment, that would be really good, I think. So I would request Brishbala to give her concluding remarks. And thanks once again, Archana, and for everybody for having me here today and having me and giving me an opportunity to conduct this very enlightening, panel discussion with great minds. Thank you.
Thank you so much. We enjoyed this panel thoroughly, and it was great initiative by Archana Madam on World Environment Day. On the we have done the unveiling of e-newsletter, and that covered everything about environmental toxin. So we will share with you all in this group. Ma'am, we'll share our newsletter that is covering all the environmental toxins and everything on this newsletter. And definitely we have to go long way from air pollution, water pollution, heavy metals and everything. We need to be educate ourselves. We need to be make aware our people, our patient, our family. Then it will be definitely one day will come when we will limit the use of these toxins. Thank you so much.
I think life revolves in circle. Initially, also, I remember when we were used to go in olden days, we would take our glass, always the steel glass. So I think things are going back to basics, and we have to use those kapde ka cap and mask, what we were used to use, rather than using the disposables. So we can put our name on our thing, wash it, and reuse the
Yeah.
mask and autoclave
It
it.
is so much kinder to our hair, Archana.
Yeah.
These washable caps compared to the synthetic ones, which
Yes.
we use and throw off.
Also,
Yeah.
that's one reason of baldness. Padma, you have just highlighted that.
No, I cannot handle that. So I'm the only one who uses those cloth ones. But I really, it breathes and you feel fresh at the end of a long list.
Surgery. That's a
Mm.
good idea. I think everyone has to learn from each one, the good points to practice. So thank you very much. And is anything anybody want to say, or we can wind up now?
Yeah, Archana, I just want to say I think it's a very good topic, and you and Rajbala have covered it beautifully. And first, people would think that what is there about environment? Simple things like microplastics in the water bottles, no plastics for heating. And I think you ladies have done a wonderful job with today's topic. And I'm sure there are a lot of good take-home messages which you can circulate later. Thank you.
Thank you, Reena, for
Thank you,
staying.
ma'am, for appreciating and staying.
Yes, I would say a very big thanks to all the faculties who have really taken out their time and come today and waited back and answered all the queries. This was indeed a very difficult and a different kind of a panel, which was so well moderated by Padma Madam as well as Brajbala Madam. Really very nice. I mean, really, I'm going to change the way I'm going to take history for most of my infertility patients for sure. Achamna ma'am, your talk was amazing. Reena ma'am, thank you for being there. Dr. Amay sir had emergency delivery, so he has gone out. But thanks once again to all the panelists, and we are looking forward for all these focus series, which is going to come the first week of every month. And Dr. Archana ma'am would be the speaker, and we wish her all the best because she's contesting to become we have already said that she would become the president for Foxy. All the best, ma'am, and we look forward for more of such different kind of enlightening topics in the coming months ahead. Thank you very much, all of you.
Thank you, Dr. Rupali. And I would like to extend my thanks to Format, especially Sudeep ji, for providing us a seamless platform and generating the email links for everyone. So thank you, Sudeep, for being with us during this academics and awareness focus series. Thank you, and bye-bye, and all of you have a good weekend, and start from today itself a small thing to improve our environment.
सब कुछ हो जाएगा मैडम, कॉस्मेटिक्स का क्या करें?
वो पता है एक लास्ट टाइम क्या था कि कोई नेचुरल कॉस्मेटिक या ऑर्गेनिक कॉस्मेटिक वाले को पता चल जाएगा कि women are worried about the cosmetic, so they will come up with some cosmetics and then that company will really flourish. So I think we have to start investing our natural beauty.
Yes.
By eating healthy and drinking cleaner
Yeah.
water.
That is
Thank you, ma'am.
Thank you very
Thank
much.
you. Bye bye.
Thank you, ma'am.
Thank you,
Thank you.
everyone.
Thank you
Thank
all.